not assembling for social gatherings, wearing a mask, keeping a 2 meter distance, frequent hand washing, and staying home if we are ill and getting tested. We have made good progress in the Peterborough area. Thank you to everyone for your efforts. Together, we will continue to keep our area safe. Be safe, stay well, and in all things, be kind.
Thank you very much, Andy. Okay, so now we will invite Dr. Salvatierra to provide us with the latest statistics about the COVID situation. Please go ahead, Dr. Salvatierra.
Thanks very much, Brittany. So as of 4:30 p.m. yesterday, we had 16 active cases in Peterborough, and that's 2 fewer than on Tuesday, and it's 15 fewer than last Friday. This continued decline in active cases is most welcome. In total, we have reported 565 cases since the pandemic began, and my team is currently following 64 close contacts. This is actually 3 more than Tuesday, and that's because we continue to have high-risk contacts identified by other public health agencies in Ontario, where their cases are naming a Peterborough resident as a contact. This is very discouraging because it demonstrates that some people in Peterborough are not staying at home and are instead visiting friends and family in other parts of the province and being exposed to COVID-19. The number of local deaths in Peterborough remains at 9. Next slide, please. There have been 7 new cases reported this week. At the end of January, we were seeing 6 to 7 new cases each day. So this is great to see our numbers continuing to decrease. Next slide, please. Here we see the trend as far as local exposures. High-risk contacts continue to be the largest source of exposure by a considerable margin over the other sources. Community spread has dropped further to only 17% of our total cases, or only 8 of the 108 cases over the last 4 weeks. Next slide, please. We continue to have 2 active outbreaks at PRHC and at Peterborough Retirement Home. Both outbreaks are considered as stable. So today I'd like to continue to offer a few remarks as far as vaccination go. As Mayor Mitchell has already mentioned, our first doses have been completed in all 8 of our local long-term care homes. The uptake rates in each of our homes has been very strong, ranging from 90 to 97%, with an overall average of 94%. We are now planning on delivering second doses into these facilities, and this will include ensuring that we are able to access additional doses of the Moderna vaccine. This morning, the Peterborough Interagency Vaccine Planning Team met, and we have shared this overall plan for our local vaccination rollout. It's still evolving, but I wanted to give you a sense of how we are organizing this massive undertaking. Our goal is to vaccinate a minimum of 75% of our eligible residents in our area. And if you follow along on this slide, you'll see at the bottom, that's just over 94,000 people, as the vaccine is currently authorized only for people 16 years of age and up. You can see that this will require multiple locations and a legion of immunizers in order to accomplish this. But I have no doubt our community has what it takes to ramp up our vaccination efforts as we receive more supply predicted for phase 2 or about April of this year. This plan that you see on the slide, as well as our full 40-page plan, is available on our website with more details. This past week, we met with our CAOs of our local townships and with the county CAO to discuss ways to strengthen our collaboration and our communication efforts to ensure that all of our residents are able to access the information they need as well as the vaccine as soon as it becomes available. Last night, General Hillier called together the provincial hospital CEOs and medical officers of health to advise us of his latest plan to ensure that as much vaccine gets into the arms of our vulnerable populations in this race against time and the COVID variants of concern. These variants are threatening us with the real possibility of an imminent third wave in this pandemic. Peterborough will be ready to deliver vaccine as soon as it arrives. Before our next shipment of vaccine, due sometime during the week of February 22nd, we plan to share with you not only the how and when that we plan to complete our second dose for residents of long-term care facilities, but also the how and the when we will be expanding our reach to the next priority groups identified by the province. I hope to share that with you at next Friday's media briefing. Of course, while vaccination planning remains a main focus, so does the containment of COVID-19 through our public health measures. As we head into Family Day weekend, I would like to remind residents that the stay-at-home orders remain in effect. That means no visiting with family outside of your household group. While we expect to move back into the provincial 19 response framework, likely at a yellow level on Tuesday, this does not mean we can let our guard down. While the COVID-19 variants of concern are on our doorstep, so we must remain as vigilant as possible. There is global evidence to show that countries that kept strong public health measures in place were able to keep cases low, even despite the prevalence of the UK variant. So now is the time for all of us to refamiliarize ourselves with the requirements of the restrictions in the yellow zone and to adhere closely to them come Tuesday. These include limits for certain organized public events and private social gatherings where physical distancing can be maintained. That means 10 people indoors and 25 people outdoors. In staffed facilities such as banquet halls where physical distancing can be maintained, the limits are 50 people indoors or 100 people outdoors. However, please be advised that there are new restrictions which apply to all individuals that will require a minimum of 2 meters of distance from all non-household members. That means that you will not be sitting down at a table to share a conversation, a meal, or a drink with friends or other non-household members, whether it is in your home or at a restaurant or at a wedding. It means you can't go shopping with a friend, and you must wear masks in all indoor settings whenever non-household members or caregivers are present. The wearing of masks is also advised outdoors whenever 2 meters of distance is not possible. And I would include city sidewalks just to be safe. Our website will be updated with the details as soon as we receive confirmation of our color status, and we will actively promote the public health measures next week. Thank you.
Thank you very much, Dr. Salvaterra. Okay, now we will have a chance to hear from our elected officials. I see that Chief Carr has been able to join us. So Chief Carr, if you have any comments you'd like to make, and then we can move on to MPP Dave Smith, as I understand he needs to leave by 12:30, and then we'll move on to the others. So Chief Carr, if you have any comments you wish to share, please go ahead.
Hi, Brittany, and good afternoon, everyone. No comments. I think what I'll just would like to reiterate now that, it feels better to be opening up a little bit. And just like to reiterate what Dr. Salvaterra stated in regards to still being vigilant and being careful so that we can, we're all able to receive our vaccines and work through this process and know that at the end of this, as I heard it before, as we're stronger together when we stay apart, and then we can be together later. And I think that's what we're all hoping for is, we've been through this a year, we're just that much closer and looking forward to that time when we can do that. So miigwech, thank you, and I'll stay on if there's any questions after.
That's wonderful, Chief Carr. Thank you so much. Okay, well, let's hear from our MPP, Dave Smith. Please go ahead, and I will spotlight you if your camera's up.
Thanks, Brittany. I really appreciate that. I'm going to take a little bit of a different approach on this. I'm not actually going to talk very much about COVID. With Dr. Salvaterra's announcement this week, I wanted to say some words to that. Dr. Salvaterra, you have been part of this community now for just over 13 years. You have adopted it as your own. And throughout your time here, you've had a number of different challenges that you've had to face. Not the least of which is some of the elected officials. I don't think that we need to go into that. You have shone throughout all of this, though. And what I can definitively say is that our community is in a much better place today because of you. You have given so much of yourself. You have had fantastic leadership, provided fantastic leadership and guidance throughout this crisis. And the fact that our community has had such a low infection rate is an indication of the desire that you have given to make sure that this community is kept safe. I can't thank you enough for all that you have done. You have been a beacon of light during this crisis. Thank you so much for all that you've done.
Thank you very much, MPP Smith. That's lovely. So I will now invite our MP, Miriam Monsef, who I see has joined us. If she has any updates to share, please go ahead, MP Monsef.
Hello, everybody. I'm having a bit of a glitchy system. Would you mind coming right back to me, Brittany, while I sort it out, please?
Of course, no
Thank
problem
you.
at all. So why don't we move on to our municipal colleagues. County Warden Jones, if you've got your camera on, I'm happy to put you on screen if you've got any comments to share.
Are you hearing me okay?
Oh, you're a little quiet, actually.
That's a change for me. Hold on.
Isn't technology fun?
Oh, I know.
Oh,
There,
that sounds much better. Thank
that's
you.
much better. Okay, Miriam, I just want you to know your signal will get much better once we get our internet situation solved with your help. Just rubbing it in, Miriam. Anyway, not a lot to say. I do want to echo Dave's remarks about Dr. Salvaterra. Absolutely right. The community has been so much better off because of you. So I won't be sickening about it, but thank you very much for everything you've done. So the county, we're puttering along quite well. I won't bore you with any long diatribe. Again, thank you to everybody out there who's doing what they're doing. And let's not let our guard down just yet. I know it sounds great, but we've been through this before. So let's just keep our head above water and do what they tell us to do. Thank you. That's it from Peterborough County. And keep doing the great job you're doing.
Thank you so much. Okay, let's we'll give MP Monsef a bit more time just in case, because I appreciate what it's like to deal with technology. Mayor Therrien, are you able to share any comments, and did you want me to put your camera on, or we can
Hi, Brittany. Yes, I'm here, but still on my personal laptop, which is not compatible with Teams. But just quickly, again, to echo MPP Smith's words, Rosanna, you're a rock star. Our community is better for everything that you've done, and everybody at Public Health. You are so appreciated, and our community has done so well because of you. And so again, everybody on the call, we're working towards this common goal of getting these vaccines out and helping our community reopen and get back to the sort of new normal. So from the city's perspective, we've been working with public health however we can. So by providing staff or facilities to help with this vaccination process. And we'll continue to do that during this critical time. And again, I know we're all very excited about the prospect of reopening, but as my colleagues have said, we can't take it for granted. We need to abide by the best practices that we are all very familiar with by now. So masking up, physical distancing, staying home if you're not feeling well, just generally using common sense, being smart and being kind most of all. I know that this is, February is always a difficult month, even in the best of times. So certainly there's a lot going on mental health wise, and those are just challenges that are sort of compounded by this pandemic. But we are, all in this together, and we will get through this together, and the sun is out. And so I'll just leave it there for today, but thanks everybody for all the work that you do in making our community a better, safer, and healthier place.
Lovely. Thank you so much, Mayor Terry. I'm glad you could join us today. Okay, Miriam, I'm going to put you up on the screen, and hopefully the gremlins have left your computer. So please go ahead.
Thank you, Brittany. I don't know if this happens to anybody else when their computer glitches, but like my heart is racing and I'm just waiting for it to not work. And it is so nice to be with you. Thank you so much for bringing us together at a really important time so consistently. We appreciate all of you. Thank you, Mayor Mitchell, for your important words. Today, I'd like to talk about the good doctor, new funds, vaccination, travel and rapid testing, and an important reflection about what's ahead of our community in terms of choices ahead of us over the next 2 to 4 weeks. Happy Friday, everybody. I want you to know that last night, as we usually do, local leaders and everybody's welcome, by the way, if you want to join one of these weekly Zoom calls, they're helpful. We've been having them since March. They help us coordinate our local response and leaders, leaning on each other. Last night, for the first time in a really long time, as we approach the 1-year anniversary of the pandemic, we had a really hopeful and exciting conversation with leaders in the charitable sector, in post-secondaries, economic developers, as well as our elected officials. And of course, public health was at the table too. I just want to let you know that that sense of hope and optimism is founded. We have gone through a really difficult year. February has been challenging. The vaccine instabilities in supply, they have caused a lot of anxiety for everybody. And I can assure you that no one wants more vaccines into Canada faster than the government of Canada. And the Prime Minister announced earlier today that there is stability and strong flow of many, many vaccines into our community over the coming weeks. I am thrilled to hear that long-term care homes, including Fairhaven, residents have received the first dose of the vaccine, and that public health and our frontline partners and the province are ready to go with the next dose and for the big lift ahead of us in vaccination. In terms of the sad and exciting news that we heard, one of the hard lessons of COVID is that public health matters. The social determinants of health are real, and community-based supports and coordination make a world of difference. The magic sauce is always in the team, but leadership matters. Dr. Rosanna, Dr. Salvatera, I want to congratulate you on a remarkable and intense tenure as our Chief Medical Officer of Health. We're going to toast you properly, safely when it's right, but from opioids to clean water to housing to the pandemic to just being an amazing human and an inspiring woman that so many of us look up to. Your tenure is an honorable one, and we're grateful that you're going to stick around and see this vaccination thing through. On whatever is next for you, uh, Madam, the world is your oyster. Thank you for your good care and for your leadership. You inspire me. You inspire us all. You've saved lives. You've transformed lives. And I look forward to that celebration in person to toast you, your impact, and your legacy with the steady hand in this very difficult disruption and time of rapid change. Thank you for staying for the rest of vaccine rollout and waiting until we get someone into your very smart shoes. As the Minister for Women and Gender Equality, I am proud to call you my Chief Medical Officer of Health, our leader in this difficult time, and to have a role model like you to look up to. I know that lots of little girls and folks watching are thinking about what's possible for them through your example. I'm going to stop gushing now because it's Friday, and I'm sure that colleagues want to hear a bit more about funds available. But thank you, doctor. Thank you. Thank you. And I'll toast you with my apple cider hot tea. Cheers. Um, on new funds available, Warden, the Universal Broadband Fund, has received hundreds of applications, and we are rapidly approving projects. I've announced some Ontario projects already. We've moved forward with some Alberta projects already, and there is more to come. Thousands, if not hundreds of thousands, are going to be better off because of it. And of course, our community is going to be better connected too. This week, $3 billion in permanent public transit funding were announced by the Prime Minister. That $3 billion in public transit funding. Here's a call to every one of you climate activists who's been asking for electric buses and greater safety and accessibility. This is our moment, and the predictability in transportation money is because of municipal leaders pushing so hard. So thank you so much for that advocacy. Yesterday, I announced $100 million for feminist response and recovery funding. If you would like more information about how it's going to help to grow the feminist workforce, women who've been hardest hit by COVID, or greater safety for the most vulnerable in our communities, please reach out to my office. For the arts and culture sector, my colleague, Minister Guilbeault, announced the extension of arts and cultural supports for another year. Reach out to my office if you have any questions. Earlier this morning, Her Worship, Mayor Tarian, and I stood together and celebrated with the Kawartha Participation Project the second phase of their housing development supports and the new over 70 new units of affordable, accessible, energy efficient housing for our community. The KPP project was the result of a housing summit that the mayor and I co-hosted the summer of Tent City. KPP was one of the partners who approached us afterwards and said, we have a plan. And, 2 years later, those apartments on Water Street are going to be ready to go and complete totally by fall of next year. That's incredible results, and also excited about the Peterborough Housing Corporation housing supports that are coming forward and the decision for our community ahead. Vaccine, we're going to have 84 million doses. There's going to be greater stability in the supply. We're getting ready for the big lifts. Many thanks for everybody in the community who's going to literally roll up their sleeves and do what they can, as Andy Mitchell says, all hands on deck to roll out the vaccine so that we can put the pandemic behind us. This morning, the Prime Minister updated Canadians on travel restrictions. In addition to the suspended flights to certain destinations, international flights are arriving at only 4 airports in the country. Starting today, though, people returning through land borders, people driving, will be required to provide a negative PCR test within the past 72 hours. All travelers, air and land, must quarantine for 14 days upon return, or face significant fines and possible jail time. Air travelers landing in Canada will have to quarantine in a hotel at their own expense starting February 22nd. It's hard, but it is only going to last a little bit longer. Hang on, people. Please continue to do your very best to follow public health guidelines. Spring is ahead and things are getting better, and your actions matter. The border measures will help stop the spread of COVID and variants. You may be worried about the new strains, but we have our best experts working on detecting them, understanding them, and tracking new cases. I understand that I've taken up a lot of time. I won't talk about rapid testing unless colleagues have questions. Let me just comment on one more thing, and then Brittany, I will hand it back over to you. Yesterday, the city of Peterborough published 2 reports on the future of affordable housing in our community. I know everybody's really busy right now and you got a lot going on, but the decisions that we make about our future in our community over the next few weeks, including the next 2 to 4 weeks, are going to determine the growth and the sustainability and the inclusion of our community on the other side of the pandemic. So democracy is a two-way street. Read those reports. There's 2 of them. They're not that long. Get involved. Let council know what your best advice is and the kind of housing you want to see built in the community. And know that as your member of parliament, I'm always going to be ready to work with whoever can build the most housing fastest, because the pandemic has also taught us that staying home is important, and that not every home is a safe home and not everyone has a place to call home. So let's build those 2,000 units as quickly as possible and give everybody the dignity, the safety, and the opportunity that comes with a safe and affordable home. Thank you, Brittany.
Thank you very much, Miriam, for that. Okay, now we will move on to our questions from the media. I see Reg Watson from the Peterborough Examiner has his hand up. So Reg, would you like to go first today?
Sure. The question is to Mayor Therrien. Has the city considered lifting the state of emergency?
Yeah, thank you. That's a very good question, and something that we're certainly looking at in alignment with what the province is doing. And our policy group talked about it this morning, and we'll be discussing it again on Monday.
Thank you.
Brittany, have we lost you?
Sorry, I was on mute. My apologies. Okay, let me move along. I see Noor Ibrahim from Global News is here with us today. And if you have a question, Noor, please go ahead.
Can you hear me?
Yes, we can hear you. Maybe a little louder, actually.
Okay, I get that a lot, so I've been practicing. Thank you, Brittany. My questions today are mostly for Chief Scott Gilbert and Dr. Rosanna, if possible. But I just wanted to talk about the police haircuts situation. My understanding is that members of the Peterborough Police received haircuts under provincial lockdown sometime in April and sometime in January. Is that true, Chief?
Are you able?
That's correct.
Thank you, Chief. Could you explain the reason why?
Well, members of the service, frontline members, came to the command staff with a concern in relation to their ability to properly wear some of their safety equipment, bike helmets, ballistic helmets, radio earpieces. And they asked whether or not it was possible to have someone brought into the station for them to receive haircuts so that all of that equipment would fit properly and it wouldn't cause an officer safety issue. As well, as you should be aware, police officers have appearance standards that they have to maintain, and that was not the least of it, part of the reason for it. So the members asked, and we made an inquiry of Peterborough Public Health if that was something that we could actually accommodate during a lockdown. And there was a discussion related to whether or not it could be done safely, the requirements that public health requested we put in place in order for it to happen. So all of that was complied with.
Thank you for that, Chief. Given, as you said, it is kind of a safety concern for the officers, do you feel like this is something that you will continue to do moving forward, whether or not we are still in a lockdown?
No, because obviously they have the ability to access it outside of the workplace, and this was not something that was paid for by the police service or by taxpayers. This was something that was paid for by the officers, and there'd be no reason for us, if we're not in a lockdown, where they're able to access that publicly available service elsewhere. That way they can maintain their appearance standards and be fit for duty when they come in, and their equipment can be properly worn.
Thank you. Sorry, I should have worded that better. Do you think that this is something that police officers will continue to do if we are in a provincial lockdown and they need the haircuts for safety concerns, as you said?
Well, quite honestly, I think that everybody looked at the safety concerns for the officers, but they didn't look at the optics of how the community might view that. And certainly when we look at the lens of how some members of the community have viewed it, I think that we'll have to be much more cognizant of that. And I would probably suggest that the answer would be no, that it won't be allowed. However, we'll have to cross that bridge when we come to it.
Thank you for that, Chief. And I'm glad that you mentioned that kind of like comment from the community. I know this is a bit of a difficult question, but I do have to ask. We have a business owner that said that when they heard the news, it felt like a, quote, slap in the face. Did you expect that some businesses would react that way, that they would feel, a bit discouraged, were this person's words, because someone was allowed to give police haircuts at a time when everyone else was forced to close?
Well, I certainly hear that person's concerns. However, the selection process, if you even want to call it that, was the members that were taking part in this activity were the ones that selected who the barber was that was going to be brought into the station. So it's unfortunate. It could just as easily have been that individual that they selected.
Okay, interesting. So it was just kind of like a recommendation from a police officer in a way?
It was recommendations from the officers that needed to conduct, that needed to comply with the appearance standards and safety concerns that they had.
All right, interesting. Thank you, Chief. And Dr. Salvatierra, if you would, please answer this question. Could you just describe the process? What was the process of getting this approved?
Well, it was Chief Gilbert approached me for some advice, and I think it's really unfortunate that this news has irritated some community members. I understand we've been at this now for over a year. People are getting tired, and that it has meant that many people have had to sacrifice a great deal. But I actually want to commend Chief Gilbert for seeking my advice first to see whether it was actually safe to continue with this policy during the lockdown, and to seek my advice on how to do it in a way that everyone was protected. And that meant both his staff as well as the operator who was brought in to provide this service. So it was all done very well and under my direction. And so I just wanted to thank the chief for doing it in cognizant of ensuring that the public health measures measures were in fact adhered to.
Thank you, Dr. Salvatierra. Do you know, like, was it, sorry, like, did you guys like kind of have to visit the police station and kind of see like what area they're supposed to go to, or visit the barber? Like, how did the haircuts itself go, I guess?
Well, I provided Chief Gilbert with my advice, and that was based on my conversations with my own staff. And I just, and it was left with him in his hands to ensure that our instructions and advice were followed.
All right, so I guess this is a question for you, Chief. How were the advice and protocols followed?
Well, the protocols were followed. It was PPE for the officer as well as the person doing the hair cutting, which also included a face shield for that person and a full gown, and the availability of hot water and cleaning supplies had to be in place. So all that was looked after, and obviously when it was being conducted, we at least were able to determine who got it done, and for contact tracing in case there was an issue down the road. So it was conducted in exactly the manner that Public Health had recommended to us, and I had no concerns about how it took place at that time. I was confident that the correct procedure was followed. And we are cognizant of the optics of it, and we do promise to do better moving forward.
All right, thank you, Chief. And last question for you, I promise. So my understanding that this happened at the station then?
That's correct.
All right, thank you, Chief, and thank you, Dr. Salvatierra, and thank you for everyone who was forced to listen to this while other people had questions. Thank you.
Brittany, I think you're muted.
My apologies that I keep doing that. Thank you so much, and just want to give all of our media on the line a chance to ask some questions. So let's move on to Taylor Clydesdale, and if he's got some questions for our speakers. Go ahead, Taylor.
Hi, thanks, Brittany. I'm going to go ahead and hazard a guess and say Dave Smith's probably moved on to his 12:30 appointment then.
I believe so. He has. Let me just check. Yeah, he's not on the line.
All right, that's very fair. All right, so then I'll ask Dr. Salvatierra. So right now, cases are kind of on the decline in Peterborough. They're on the decline in Ontario, actually, which is good news. Yes. I don't think, generally speaking, I think that's in no small part due to the lockdown restrictions that we have been under for the past little while. But you said yourself that, we're looking at an imminent third wave. Do you think that the lockdown restrictions that we have right now should be remaining in place until we can get the vaccine distributed amongst the general public?
Well, that would be, if we had more vaccine, Taylor, that would be the ideal option, but we don't. And we have such limited supply of vaccine. And I think we're all cognizant of the hardships that people have had to endure because of the lockdown. Now that the numbers of cases are so low, I think, as I said last week, we've had lots of time to learn about the public health measures and to adopt them and to use them correctly. Everyone now should know how to put on and take off a mask. People should have them. People are aware of what 2 meters looks like. And so I'm hopeful that with the reopening and the additional measures, so as I said, all individuals now must keep 2 meters of distance between them and anyone who is outside of their household. That's new. It's now in the regulation, as well as additional measures for the wearing of masks, for the active screening, and for operator to have a safety plan that's well developed and also posted. So fingers crossed, if we can adhere to these measures, they should work. As I said earlier, in other jurisdictions where the UK variant has been prevalent, the measures were able to contain the spread. So it's really up to us. And as I said earlier, I get disheartened when I learn that we've had high risk contacts here in Peterborough. Then that means that people here have gone and visited. They've not stayed at home. They've left the area. They have gone to other areas in the province. They have visited with friends and with family, and then they have come back, and they put all of us at risk. When they do that. So I'm hoping that over this coming weekend, we can all stay at home. And as I said, it is family weekend, but it's family with the people that you live with and not with family in other places. So we really need everyone to stay home and to follow the rules. And I'm sorry for being so long-winded. I didn't mean to go on and on, but that's the answer.
Hey, no worries. I mean, if you are want to be long-winded, that just gives me more quotes, so that's fine. You touched on it, and I do want to dive a little bit deeper into it too, about the number of high-risk contacts. So that's due to people coming into our region from other areas, or is it due to people from our area leaving and then coming back?
It could be both. So thank you for clarifying. It could be both. But essentially, whether it's having family come to your home and having them visit for the weekend, or having friends over for a party, or whether it's you going to Peel or somewhere else in the province and visiting, in either of those situations, the answer is no. It is just not safe. So, yesterday, I believe we had only 2 cases, but we had 10 high-risk contacts identified. And so, again, that just speaks to the fact that there are still people who don't get it. And I understand your friends and your family, we miss each other, we love each other, we're familiar, we don't believe, how could you possibly harm me? But the reality is that this virus does not have legs. And the only way we come in contact with it is when other people carry it and expose us. So more than ever with these variants, we have to adhere to the public health measures.
Thank you, Dr. Salvatera. Hopefully we can get that message across.
Thank you.
But unfortunately, we're nearly a year into this now, and I'm sure there must be some fatigue among people that are just saying, screw it, and doing things anyway. So I'm sure that's a problem that you guys are dealing with on a daily basis now.
Well, we're almost at the end. We're almost there. We don't have a lot further to go. And so we just have to give it that little extra effort.
I just have one last question, and potentially for Board Chair Andy Mitchell, potentially for Dr. Salvatera. I don't know who would be the best person to answer it, but just looking at the minutes of the last Board of Health meeting, just looking at the support for the paid sick days bill, just wondering if there's any additional information, why is public health endorsing paid sick days? And do you think that that will become a reality?
Maybe Dr. Salvatera can start with that.
I can begin, and I shared with the board, Taylor, our own data that shows that, our highest case count in Peterborough continues to be in the 20 to 29-year-olds. Most of these individuals are working. And when we investigate, what we have found is that many have gone to work while they were sick, have postponed testing, because of the fact that it would interfere with their ability to work. And we often don't find these individuals until they are identified as a contact. And so the fact that there are no unpaid that for many of these workers who are working in essential services and often are often precariously employed as well, the lack of access to paid sick time just fuels this pandemic. I shared with the board my own experience in talking with one of these people who went to the Emerge because he had pneumonia, but was not able to stay at home because of the loss of job and income. And so they, in order for people to behave and stay home when sick, we need to make it possible for them. And that means paid sick time, especially during infectious disease emergencies like COVID-19. So that's what I shared with the board, and I'm wondering whether Mayor Mitchell would like to add to my comments.
Yeah, just briefly, what I think the perspective is, we don't want people to have to choose between being able to afford their rent and afford to put food on their table, and keeping people well, and having to go out when they're ill. And so the idea of ensuring that an individual can stay home when they're ill and not affect people, and be able to get a sick paid leave. That's the perspective that the board took, and as the doctor mentioned, during a health emergency that we're in right now, that's particularly critical.
All right, I think that's it for me. Thank you all so very much.
Thank you.
Great. Thank you very much, Taylor. Okay, I will now invite Matt Latour from Oldies and Freak Radio if he has any questions. Go ahead, Matt. Oh, he may just be recording and not able to join.
Actually,
there he goes.
It's Graham here actually today.
Oh, it's Graham. Nice. You're posing as Matt today.
There
nice to have you.
We just wanted to find out a couple things. I know that we're still waiting for the official announcement from the province later on today. I know that you sort of let the cat out of the bag there earlier, Dr. Salvatierra. I'll leave this open to either city officials or for you, Doctor, in regards to city facilities. I know we have a lot of hockey fans in the area there looking to find out whether they can get back on the ice sometime in the next few days or not.
I wonder if the mayor would like to answer that.
That's a good question, and I wonder if Brendan would like to answer that.
Thank you, Mayor Terry.
I'm sure we're working on that and trying to figure it out. Brendan, you might have more information than I do at this point.
I don't, Mayor Terry. We're still collecting that information, and that's to be determined. Hoping to get some information out shortly, though. Thanks, Graham.
Certainly, we are, focused on that and how we can do that in the most safe manner possible. But we know that people are raring to go, so we'll definitely keep you in the loop.
Dr. Salvatierra, I'll actually turn it back over to you in regards to the same issue. I know we talked in the beginning of the latest shutdown about some of the concerns around the hockey play here. Are the main protocols still going to remain in place once we can have a lot of these teams back on the ice? And I mean, obviously we're getting close to spring as well, so I know that baseball teams are probably starting to come forward too.
Well, I saw you cut out a bit at the end, Matt.
Yeah, I was saying that I know that we're getting into springtime, so I'm sure that a lot of baseball teams, I know I'm involved with Challenger Baseball, for example, and we're starting to work on our return to play. So are we starting to look outside the scope of just hockey and into baseball and other spring and summer sports too already?
I can assure you that conversations about sports and how the playing of sports will be impacted under the new framework and with the new restrictions in place, that those are actively being discussed as we speak. And at the provincial level, we have been advised that there will be some guidance that we can use then in our own communities as far as playing of hockey within the different colors. So I haven't seen that yet, Matt, but I'm sure that as soon as we have it, we will make it available to our partners, our municipal partners, as well as members of the public.
Just one final question. I apologize, it's been asked already. Are we looking at a situation at all, or have we considered a situation like they did out in the Hastings health unit, putting the order in place for outsiders coming into our community to shop and get services here?
I am looking at additional tools that I have at my that I have in my toolbox, let's say, to try and protect our citizens of Peterborough if I feel, as needed. So I am looking at what Hastings Prince Edward has done as far as restricting access to people who are within the same color or zone. And also I'm looking at Niagara, where in fact they put in additional measures to prevent people from non-household members from being seated together in restaurants and bars. So we are looking at those, and I will, with the deadline that we will have any additional tools ready for Tuesday so that our operators are aware of what we expect of them.
That's all I got. Thank you.
Great. Thank you very much, Graham. Okay, let's stay with our radio colleagues. I see Trent Radio is on the line. Is that you, Rob? Did you have any questions for Dr. Salvatierra?
Hi, yes, it is. Thanks, Brittany. Can you hear me okay?
Yes.
Yeah.
Okay, great. Thank you. I just have one quick question for you, Dr. Salvatierra, of clarification. You've mentioned that there's high-risk contacts that have been a result of travel to and from Peterborough. And in the case counts, we see them broken down as contacts and travel. And I noticed in the last 4 weeks, there was only one travel case. Is it the case that if there's a known contact, even if that known contact was elsewhere, it wouldn't be considered a case spread by travel?
Right. The travel, we are identifying travel as international travel. So that for the case that we do have, for example, was travel to the USA. And that's why you don't see it captured. Most of the travel that's going on is close contact travel.
Okay, perfect. Thank you very much. That clarifies it for me.
Great. Thank you, Rob. Okay, we'll give Paul Rellinger a chance to ask his questions, then Jessica, and then we'll move back to Reg, as I see he's got his hand up. But go ahead, Paul.
Thanks so much, Brittany. And Dr. Salvatierra, first of all, I couldn't make the media gathering yesterday, but I wish you nothing but good things moving ahead in your retirement. And as for questions, I know you've kind of covered this in other, I think you've kind of answered this in other ways, but I'm going to ask regardless. Other medical officers of health have really been adamant urging that stay-at-home orders be extended. They know, even though their numbers are going down. Was there ever a thought in your mind similar to that? Where are they coming from compared to where you are?
Well, you have to recall that in some parts of the province, the incidence rates are, although they're coming down, are still significant. And in addition to that, they have evidence of variants of concern. We are very fortunate in Peterborough. Our incidence rates now, if I look at this week, I mean, we're back for incidence rate, we're back in the green. We have not had any variants of concern identified, even though the province is screening for variants. And in fact, we've even asked for some of our cases to be tested. So we don't have variants of concern. I think given that, we, like Hastings, Prince Edward, and Kingston, and Leeds Grenville, are in a position where I think it is safe to reopen. But as I said earlier, we have to do so very carefully. And we really need everyone to comply with the public health measures in order to do it safely.
Okay, great. Thank you. And this is probably the obvious question, but I think it needs to be asked just to be clear. Based on where our numbers are for this week as of yesterday at 4:30, you're confident that we will be entering the green zone? You don't see any situation there with next week?
Well, I think I think we would hope we were green, but I don't believe we will be green. I think the more cautionary approach would be to go with yellow. We've only been in green this week. So I know many Peterboroughans see this as a matter of civic pride because it does take so much sacrifice. And I think we should be proud that as of this week, we are trending in green. However, whether the province, because it's a cabinet decision, whether they decide to put us in green or in yellow, it really doesn't matter. I think certainly the approach that we've been using with the framework is slow to go down and quick to go up. So if we need to stay in green for another week just to prove that this is the place where we belong, that's fine. So stay tuned. We should know later today whether it's green or it's yellow, but I won't be too offended if it's yellow.
So again, just to be clear, yeah, the hope is green, but your expectation is yellow for next week.
I could understand going into yellow, yes.
Okay, and just one more thing, and this is regarding reporting of close contacts. I know the health unit to the west of us, they not only report their close contacts, but they also report close contacts who developed COVID and on their site. And I'm wondering why we don't do that here, and the benefit of doing that if we should go that route.
I'm not sure, Paul. You're the first person who's asked for that data. So I can certainly take it back to our case and our contact management team and advise them and see whether this is something we could add and whether that they would agree that there's some benefit in showing that. So we'll follow up.
Okay, no, that's great. I appreciate your time, Dr. Salvatore, as always, and have a great day.
Great, thank you very much, Paul. Okay, well, let's hear from Jessica, and I believe that Reg Watson has the information he needed. So Jessica, you're our final reporter today. Please go ahead.
All right, thanks, Brittany. Dr. Salvatore, you mentioned the 2 meters distance is now part of legislation. Was it just a recommendation, like a strong recommendation before, and now that's changed?
No, not quite. I mean, it was always there under the instructions to premises, but it's now been added to, if you look at the regulation, there's instructions to individuals, and that's where it's been added. So, so I just think it's an added emphasis that it's up to all of us, and it's not just up to the storekeeper. You know, it's really up to all of us that we need to keep that 2 meters distance.
Okay, thank you. So, you know, you say we're trending towards yellow, but our case numbers are going down. You've explained before that there's a lot of factors that go into it. What do you think it is that would be keeping us in yellow?
The fact that it's that we've only been green really since this week. So I think what in general we would like to see is that there's some stability in the outbreak, just like with an outbreak in a long-term care home or in a facility. We wait until at least one incubation period before we would declare the outbreak over. So that's how we tend to do things in public health. We're very cautionary, and we want to make sure that we don't act too quickly. So that would be the reason that I mean we declined. When you look at our epidemic curve and our you'll see that we had a quick decline over the month of January from a peak just at Christmas, and it was quite a precipitous decline. And we didn't even stay in yellow very long. We moved pretty quickly through yellow. So as I said to Paul, we're currently in green, and it's great to be here, but we've only been here for a short while, and we might just want to wait and see, especially with the weekend, the family weekend coming. We might just want to see and make sure that we have landed firmly in green and can actually stay there for a while.
Okay, thanks. Now, it seems like I don't know if it's just me having a hard time grasping what's supposed to happen on Tuesday. So am I understanding this correctly, that our stay-at-home order will lift as well as our shutdown order. We'll go into what you believe is yellow, and then so we can go back to shopping and stuff again, but under new restrictions.
Yes, stores, operators will open, restaurants and bars will open, and you will be able to go. You won't have to just stay at home. So right now you're staying at home except for essential things like grocery shopping or picking up your prescriptions or going to school. But as of Tuesday, you will be able to go out, and there will be more public and private facilities that will be open. You'll be able to get a haircut, Jessica.
Wonderful. What was I going to say? Dr. Salvatierra, your restrictions have been a little bit stiffer than the province's. If the province, says that we can start mingling again, are you going to advise that?
I don't think that's in the chords. Sorry, chords. I'm thinking of music. I don't think that's in the cards. Socializing is just not safe right now. We need to, I think if we are going to socialize, it will be in large spaces with at least 2 meters distance and wearing a mask. That's as close as it is safe to get right now, especially with the risk from the variants.
Okay, so basically if the province doesn't say that, you're going to still enforce that household members only.
Household members only, and I am prepared to either through issuing a Section 22 order or using my ability to issue instructions under the Reopening of Ontario Act. I am seriously considering doing so just to ensure that people don't take advantage of this reopening and to put others at risk. We just can't do that right now. I mean, if we had more vaccine and more people were immunized, it would be more of a possibility, but we're just not there yet. And so to do so is risky, and we need to keep our distances.
Okay, thanks. And my last question, Dr. Salvatierra, is for my colleague working on a March break story. What are your thoughts on March break being delayed?
Well, I can see advantages to delaying it until after the weather improves a little better, so that people can be outdoors, and especially our children, so that they can exercise and take advantage of the outdoors. I'm hoping that will be the case. April is not always a guarantee for good weather, but I'm hoping that by the time we are all able to have a break, and it's a well-deserved and much-needed break, so I certainly understand why teachers and why students are disappointed in seeing it delayed. But I'm glad that it isn't a long delay. I think by then we'll have more people immunized. And that's important, more of the vulnerable people immunized, so that even if they do get exposed, they're protected. And as I said, having better weather will certainly make it easier for us to take advantage of that time away from school.
Okay, thank you so much, Dr. Salvatierra. I appreciate your time. That's it for me.
Thank you, Jessica. I see Chief Gilbert has his hand up, and then maybe we can get to Paul's last question. Do you have a question for us, Chief Gilbert?
No, just a comment, and I just wanted to thank Dr. Salvatierra and Peterborough Public Health for all the work that they've been doing, not only in the community, but with our service. The fact that, we've been into this for almost a year now, and it's a credit to Peterborough Public Health, the advice and great direction that they've provided to us a variety of times throughout the year on how to keep our members safe. And other than one member testing positive as a result of travel prior to the pandemic being declared, we've been very fortunate that the advice that's been provided, the direction and great help and support of Peterborough Public Health and Dr. Salvatierra has been keeping our members safe. And with the number of community contacts that they have, dealing with the public, it's also kept the public safe. So once again, thank you, Dr. Salvatierra, for your service. Thank you for your great advice, and thank you for all the support and the advice of your staff. It's been greatly appreciated in keeping our people safe.
Thank you very much for those kind words, Chief Gilbert. Okay, let's hear from Paul. I hope you have time, Dr. Salvatierra, for 2 more quick questions from our media, because we are a bit over our time. So go ahead, Paul.
Thank you, Brittany. It'll only take a second. When we talked about Dr. Salvatierra, yellow versus green zone, how much of a factor is playing that in that decision in the fact that we have 2 ongoing outbreaks as well?
Well, certainly that is one of the elements that is looked at by the province. They look not only at our transmission in the community, but also what's happening in our facilities. So the fact that we have 2 and not 0 would be reason to be more yellow than green, but the fact that they're well controlled and hopefully will, at least with 1, hoping that it might be over, we'll be able to declare it over in the next few days. So the outbreaks do get they are accounted for, Paul, as part of the decision as to which color we are.
Great. Thank you for that clarification. Appreciate it.
Okay, thank you, Paul. Reg Watson from the Examiner, if you've got one more question, please go ahead.
Well, it was a quick question for Chief Gilbert, but I believe he has left the meeting, or Julie Ingram, whether there's been any new charges laid under the Reopening Ontario Act and other legislation this past week.
So that's a question I can take back to Julie Ingram, and it might be best to follow up with Sandra Dewick from the police service with regard to that question as well.
Okay, that's fair. Thank you.
Thank you. Okay, that's great. Well, thanks everyone for your time today, and wishing you all a wonderful Family Day weekend. Looking forward to seeing you back here on Tuesday. And stay safe, and we will catch up again soon. All right, all the best. Take care, everyone.
Thanks. Thank you.
Thanks, everybody. Have a good weekend.
Thank you. Have a good weekend. Thank you.